So when we look at rural health and we look at telehealth, we see a fantastic way that they work together. It's not a matter of getting to the doctor's office. There is no doctor's office. And what we've seen with telehealth, especially during the pandemic, is how it put tens of thousands of new front doors on offices where providers could meet people where they were. And all of the technology is just an extender. It gives you more ways for people to go in and receive high quality care. And that's really our concern. When it comes to behavioral health, one of the things that we know is that even before the pandemic, there was a real access issue. From our viewpoint at URAC, during the pandemic, behavioral health care utilization actually increased because people had the increase in access, but there was also a decrease in the stigma. And some of that was rural, some of that was urban, but it really was sort of this concept of so many more doors available for people to get in for behavioral health care. And so we've really seen increased utilization and good utilization in addition to the extending access into areas where they wouldn't otherwise have it. So we're really excited about behavioral health telemedicine and the opportunity that that brings for everyone to get more care where they need it. We talk about webside manner, that ability to actually have somebody connect with another person over the camera and communicate well. If you take people and you put them in a bad situation and they have a bad time, they're not going to want to do it again. So we want to make sure that the patients are educated and the providers are educated so that they can really focus on the care that's being delivered. Telehealth has been around for decades. What we're really seeing now is we're seeing this explosion of different platforms where patients can get access. And we're also seeing that the federal government lessened the restrictions that were on telemedicine from before the pandemic because there was this drive to improve access and to improve care. Our biggest concern is we want to make sure that telecare is good care, whether it's telehealth or whether it's in-person health. This really is about using this improved access to address areas like health equity and care disparities. So when it comes to telemedicine, we want to make sure that you're seeing a good provider and they're providing good care and there's good clinical oversight and the patient is getting what they need, because care is care, whether it's telemedicine or whether it's in-person care. What we have seen is that organizations that really focus on high quality care using telemedicine are really the ones who are going to meet patients where they need to be. Telemedicine doesn't replace in-person care for all types of care delivery, but it can be very important in places like behavioral health care and in areas where there's a shortage of providers. You can learn best practices in telemedicine and you can use that to deliver the highest quality of care using telemedicine. It's no longer about, can I get a video visit with a provider, but how do I make sure that that video visit or that text exchange really is high quality evidence-based care. And we're happy to work with organizations around the world on what is high quality telemedicine as we build this new field to serve patients better wherever they may be.